The Ministry of Health will this Wednesday open special flu clinics to deal with the rising cases of the H1N1 virus and to get preparations for the annual flu season underway in earnest. Chief Medical Officer Dr. Josiah Rambali says the clinics will be located in the heavily populated north of the island.
Castries Health Center, the non-emergency section of the Gros Islet Polyclinic, and Lacqua Mingo Health Center will be designated as flu clinics. Persons with flu-like symptoms will be encouraged to seek care at these flu clinics. Entrepot Health Center and the emergency section of the Gros Islet Polyclinic will now have daily doctors' clinics for persons without flu complaints. Persons without flu complaints can also seek care at the nearest health center.
Centers have not been set up in the south because there have been fewer reported cases in that region. The move towards the establishment of the clinics is one of the recommendations spelled out in the island's influenza pandemic plan. Healthcare officials explain treating the possible flu-like cases separately at designated clinics decreases the chances of spreading the dreaded flu.
A similar thing is going to happen in Region 7, that's the ancillary Canaries area, where the Lacqua Mingo Health Center will be the flu clinic, and the other health centers like Vanna and Ancillary and Jackmel will be the non-flu clinics.
Officials say the service provided at the clinics is free of charge. To date, no one in St. Lucia has died from the H1N1 virus, with generally mild cases reported on the island. But authorities fear as the number of cases rises, so too will be the severity. People predisposed to common illnesses like the cold or flu or have pre-existing conditions like asthma are also asked to be more vigilant. Director of Bureau Health Promotion, Cyprian Yard, says it is important that members of the public take personal responsibility for their health.
That personal responsibility means that you are responsible for yourself and your household. We have repeatedly asked that if you are sick and suspect of the flu, whether it is H1N1 or seasonal influenza, to remain home, do not go to work, and of course inform your employers. This is important, and there is a legal recourse for you to obtain sick leave certification to remain at home during that period.
Individuals from all walks of life, including school children who are experiencing flu-like symptoms, are also advised to stay at home and avoid mass gatherings. The National Emergency Management Organization is also intensifying its continuity plans with vital interest in the public and private sector. Director Don French says the agency is paying special attention to the agribusiness industry.
The agribusiness persons need to remember the biosecurity protocols that have been discussed over the years, just as regular proper business practices, but also now the influenza, because the virus has shown the ability already to jump species. Many people have been wondering, can you get the flu from pork? You cannot get the flu from pork, but ironically, the pig can get the flu from a human.
NEMO is also working on a policy for the public service and is employing private enterprises to seek the expertise of the office in devising their own plans. School principals and educational officials met to discuss the national response to the pandemic influenza in the school system on Monday. Meanwhile, the Corinth Secondary School is set to reopen on Wednesday after the authorities say they were successful in managing a possible outbreak at the learning institution last week. Monday marked the celebration of International Peace Day, established by the United Nations